Hey everybody, this is Chris Franchina with Policy Engineer Insurance Solutions. I'm one of the co-founders here, and you are watching our Medicare 101. This is understanding your plan options for 2024. So Medicare can be a complex system. At any point, if you need to stop and take notes, feel free to hit pause. All right, so we looked at the helicopter's point of view of Medicare. Now we're going to zoom in and look at each leg of Medicare individually. So let's start with Part A, which is your hospital insurance. Part A of Medicare covers your inpatient hospital care, skilled nursing facility care, hospice care. It even covers limited home health care. As long as it's deemed medically necessary, you can get some home health care. And that is not a complete list of all the services offered through Part A of Medicare. Now let's cover Part B of Medicare. This is your medical insurance. Essentially, anytime a physician shakes your hand, probably going to be a Part B expense. Part B covers your doctor visits and preventative services, outpatient surgery, diagnostic screenings, emergency care, even durable medical equipment. That would be things like wheelchairs, canes, walkers, etc. are covered under Part B. And again, this is not a complete list of all the services available. So now we're at the section where we're going to look at the Part B premium. We're going to look at the cost of Medicare. And now there's a calculation involved to figuring out what your Part B Medicare premium will be in 2024. So the base premium for Medicare in 2024 is $174.70, but it's based on your adjusted gross income. So now I want you to take a look at the chart you see on your screen. Everyone will walk away right now knowing their 2024 Part B premium. All right, so if you focus on the left-hand side of the screen now, you should see either filing joint taxes or filing individual taxes and the income brackets below. Now let's take a look at these income brackets. All right, so the numbers we're going to look at here on this income chart are based on your 2022 adjusted gross income. Medicare will always look backwards 2 years at your adjusted gross income to determine your Part B premium in this given year. All right, so if you file taxes jointly, yourself and your spouse, and in 2022 you filed at $206,000 or less, then you're here at the base premium, $174.70. Now, as an individual, if you filed at $103,000 or less in 2022, then you're at the base premium at $174.70. Anything above those amounts, you can see here in these income tiers, your Part B premium will increase based on your income, as well as your Part D premium, which is your prescription drug coverage. So I want everyone to take a moment and look at your income in this chart and write down your Part B premium for 2024. So unfortunately, Part B of Medicare has a late enrollment penalty. So I want to encourage you to sign up for Medicare in time and as early as you possibly can. The way the Part B penalty works, your monthly premium for Part B may go up by 10% for each full 12-month period that you could have had Part B but did not enroll. And once these penalties are assessed, they are permanent throughout the life of having Medicare. And there also is a penalty for Part D, or prescription drug coverage. The way that penalty works, 1% of the national base premium, which is $34.70 in 2024, multiplied by the number of full uncovered months you were eligible. And again, that is a permanent penalty once it's assessed. So as a reminder, sign up for Medicare in time and as early as you possibly can. Now, just to recap what we've gone over so far, original Medicare generally covers 80% of your hospital and medical expenses. Now, on the left-hand side of your screen, we're going to look at some of the things that original Medicare does not cover. That would be things like your deductibles, co-pays and co-insurance, outpatient prescription drugs, healthcare outside of the United States, and things like dental, vision, hearing, chiropractic, acupuncture, transportation, podiatry, and this is not a full list of what original Medicare does not cover. These yellow tiles you're seeing here on the screen, those might be some of the things covered in the Medicare Advantage plans or by the private insurance companies.